But there was a difference between the groups concerning pain when the surgeon palpated in the groin, where 0.8% compared to 3.3% had pain. There was no difference concerning the hypoesthesia or hyperesthesia, and nor any difference in the non-hernia related problems. However, other hernia problems, there was a significant difference between the groups, 16.7 in Viper 2 and 28 in the Proline group. When the patients were asked if they had pain in their groin right now, 20% in the Viper 2 and 27% in the Proline group answered yes, which is non-significant. At rest and on coughing, there was no difference, but when the patient raised from lying to sitting, 7.6 in the Viper 2 and 13.6% in the Proline group had pain. No difference concerning the pain during physical activity. There was also no difference if the pain impeded daily activities, but the foreign body feeling was significantly lower in the Viper 2 group, with 15% compared to 22%. So the conclusion in this study was the use of a lightweight mesh for Liechtenstein hernia repair did not affect recurrence rate, but improved some aspects of pain and discomfort 3 years after surgery. Last year, Pajanen in Finland made a study with a single surgeon himself, and he used both primary recurrent unilateral and bilateral hernias, randomized them to 3 different groups, Viper 2, Prameline, or lightweight Prameline. With a 24-month follow-up, he used the telephone questionnaire and selective visits to investigate his patients. The recurrence rate was rather low in all 3 groups, so were the analgesic use and the foreign body feeling, but there were no significant differences between the groups by any means. I used the visual analog scale to evaluate the pain, and as you can see, the pain decreased a lot after a few weeks, and there was no difference between the groups at any time. However, the weakness of this study is that the power used, they calculated on a 20% difference in chronic pain. So they hypothesized that they could decrease the rate of chronic pain from 25% to 5% by using the lightweight mesh. And they did not specify how they should evaluate the chronic pain at all. So they concluded the choice of mesh has minor impact on the long-term result if the operative technique is good. And my comment is the sample size was small. Last week, Langebach and co-workers published the online first in the surgical endoscopy study where they used the laparoscopic technique with TAP, and they used stapler. It was 2 hospitals, and they used primary unilateral hernias. They compared Viper 2 and Proline and Serapren, which is a smooth full-weight mesh, polypropylene. About 60 patients in each group, and they had 60 months follow-up, and the follow-up was through questionnaires. The recurrence rate was similar in all 3 groups, not significant. And on the pain visual analog scale, you can see the stars, which are significant differences, where both the Viper 2 and the Serapren had significant better results up to the 12th post-op week, but after that, after 24 months and 60 months, there were no difference. And if you look at the pain, development of pain measured by SF36, the result is the same. There is significant difference up to 12 post-op weeks, but after that, no difference between the groups. They concluded that a smooth mesh or a lightweight mesh has advantages concerning pain and physical function compared with a heavyweight mesh. And my comment is, but there was no difference beyond 12 weeks, and the sample size was very small in the study as well. So to summarize this, partial absorbable lightweight mesh may be preferable. In the first study, 64 lightweight hernias. In the next study, it reduces long-term pain, and the recurrence appear related to the size of the suture bites. They had 162 patients in that group. In our study, we stated that it did not affect recurrence rates, but improved some aspects of pain and discomfort. That was 296 patients. Pajanen in 2007, it had minor impact on the long-term result if the operative technique is good, but the sample size was 69 patients. And next study, Langebach, with only 58 patients. Smooth mesh, lightweight mesh has advantages concerning pain and physical function compared with the heavyweight mesh. So the conclusions I think we can draw after this look in the literature is that partial absorbable lightweight mesh may decrease pain after hernia surgery. Certain technical aspects must be considered. More randomized controlled trials are needed, especially in the more modern material like UltraPro. And national, international registries can help us to obtain more data. In the Swedish hernia registry, we are, since about 5 years now, following our patients where we differentiate between the heavyweight and lightweight meshes. So there will be some data coming up from that later. Thank you.